We are here with Dr. Hohler, who is the regional lead for neurology for Westchester County, and we are talking about dementia. So I'm going to start with the easy question. What is dementia?
Dementia is a cognitive dysfunction that typically interferes with some social activity or activity of daily living. So you can have difficulties with your memory that may be subtle with age, but when they start to interfere with your ability to do some of your normal activities, your chores, interact in some way, then it becomes a diagnosis of dementia. We also have a specific memory testing that we do, and we have a scoring system that helps us to clarify that as well, otherwise known as either the mini mental status or the Montreal Cognitive Assessment.
So Alzheimer's is part of dementia. It's not its own separate thing. And from what I've been reading lately, it used to be that Alzheimer's was, people would be diagnosed with Alzheimer's, and now it seems like they're diagnosed with Alzheimer's plus another form of dementia. Are you finding that that's more common now, that there are at least two different varieties of dementia together, or are you still finding a lot of pure Alzheimer's?
It's a very good question. So the overarching umbrella of dementia has a lot of different subsections. Alzheimer's is very common in terms of a type of dementia, and it has a specific pathology associated with it. There are other types of processes that can cause dementia, like mini strokes. People can have dementia related to their Parkinson's disease, and other issues can also lead to a dementia diagnosis. We also find patients who might have a combination, for example, of Alzheimer's and Parkinson's disease. Those are typically more rare, but we do see them, and I think part of it has to do with our diagnostic techniques and our ability to differentiate and distinguish more carefully nowadays.
Let's just quickly talk about some of the main symptoms of dementia in general, and then if you want to point out any that are specific to Alzheimer's versus globally dementia, that's fine as well.
So one of the most common issues that we talk about is memory, specific memory. And the patients who have Alzheimer's disease most characteristically have trouble with short-term memory. So what they had for lunch, what they had for breakfast, the activities that they did in the morning of that day are most commonly affected. However, a lot of people are surprised to know that long-term memory is often preserved until advanced stages of disease. And so many times with Alzheimer's patients, they'll have very vivid memories of their childhood, for example, and may even remember what they were wearing to school the first day of kindergarten. But they have difficulty with remembering what they had for breakfast. In addition, they often have difficulties in other domains. So they might have difficulties with executive dysfunction, having trouble with multitasking, difficulty with long-term planning, and shifting sets from one to another can be difficult as well.
Let's talk a little bit about the risk factors. So in 2024, not too long ago, there was the Lancet produced a list that they had updated about different risk factors. And they're categorized into three chunks. One is early life, and the risk factor there is really not a great education, right? Starting to learn and use your brain. Midlife, which I'd love for you to define for me what age range midlife is.
Well, I think that's a controversial topic, and I think midlife is getting younger and younger all the time. So traditionally, we think about midlife between 40 to 60, but oftentimes now, with people aging differently, that is expanding. And so some people are thinking about a wider berth for midlife, particularly as people live to their 90s and beyond. So it may be somewhere in the late 30s into the early 60s nowadays.
So the midlife risk factors are vascular and metabolic insults, for example, hypertension, high LDL cholesterol, obesity, diabetes, traumatic brain injury. And then in later life, it's sensory loss, social isolation, depression, and air pollution. So with all of those, the two that I mentioned were added in 2024 are the, untreated vision loss, which I guess I didn't put in here, but that's one of the later life ones, correct? And LDL cholesterol. What's your thought on the addition of the high LDL cholesterol and the vision loss as part of the risk factors for Alzheimer's?
I think they're important additions. So in terms of the LDL, what we do see is as cholesterol accumulates, particularly in the brain vessels, we do see that blood flow to the brain is reduced, which then affects cognition. So this is an important addition, and it's something that is a modifiable risk factor. So unlike age, which we can't really do anything about at this point, LDL is something that we consider modifiable. So having that evaluated with your yearly physical exam, and then having it modified if it's too high can really make a difference in terms of reducing this cholesterol buildup in the brain.
Before you move on,
yes,
can you give us what good cholesterol is like and where we should start to feel concerned versus like the oh my God
It's
factor?
a great question. There's a lot of nuances to this. So it used to be a specific number, but now it all depends on your cholesterol profile. So for example, if you have a very high level of good cholesterol and your LDL or bad cholesterol is high, you may not be at as high a risk as somebody who has low HDL, which is good cholesterol, and high bad cholesterol, LDL. So there's a specific formula with a ratio that we get back in the lab panel that helps us to determine for each individual what their individual risk is.
Okay. And so then I'm sure you were about to go into the vision loss piece.
So in my experience, and now the studies are also supporting this, vision loss and hearing loss have a huge impact on cognition. Vision loss in terms of our receptive or afferent ability, so the intake to the brain. When vision loss is impaired, it impacts our ability to read, our ability to perform on some of these cognitive tests, and also our ability to interact in our environment, our driving ability, our ability to watch what's on the television even. And then hearing is another big issue. So when we have reduced hearing, we're also impacted by our ability to understand the language that's being spoken and also to be able to discern the specific voices within a crowd, for example, environment. So those two things have a huge impact on cognition. And in fact, when I'm having my patients perform their cognitive tests, I make sure that they're in an environment that's quiet and that they have their hearing aids in place.
So I guess there's something we should clarify about the vision loss and the hearing loss. It's untreated that is more of a risk factor, correct? Instead of people who are wearing glasses or hearing aids.
Untreated. And what I would say too is that a lot of people have hearing aids but don't wear them. So you can be treated but not utilizing.
Right.
So you need to be treated and utilizing.
Okay. Out of that list, from the early life, the midlife, and the late life, if you could pick three that are the ones we could really focus on the most to change, to help prevent dementia, what would those three be?
The three biggest ones that I think are the ones that are easiest to target because they also impact the heart. And we think about the heart-brain interaction as being a very important one in terms of longevity, in terms of healthy cardiovascular system. Typically, we're going to work on our weight, we're going to work on our blood pressure, and we're going to work on our cholesterol. And those three are ones that we can monitor, that there's metrics for, and that we can track as part of the daily physical exam.
With this Lancet list, the 2024 one, they also said, based on this list, that Alzheimer's or dementia in general is approximately 45% preventable. Do you agree with that? And if so, why or why not if you don't?
I think that with early intervention, I agree that we can modify the process. So what we want to think about is if we keep people healthy longer, then they're less likely to develop the symptoms of cognitive decline during their lifetime.
Okay.
So what we're doing is we're helping people to live longer. And as a result, we're seeing more cognitive decline over the course of people's lives. So what our goal should be is to help people to live longer and also push further off the deficits that come with cognitive decline. So what we can do is, it may not be stopping it altogether in a lot of cases, but what we may be able to do is delay the onset of those cognitive issues as long as possible.
So that's what we'll spend the rest of our time talking about. So if you had a 40-something, a 50-something, 30 or 60-something too in front of you, whose main goal was to reduce dementia, what should they, when they go for their annual checkup, be really focused on, and if they should be monitoring it on their own, when and how often?
So what I think about in terms of early prevention for any type of neurologic disease, and this goes for stroke, Alzheimer's, Parkinson's disease, dementia in general, is that we want to be thinking about optimizing our lifestyle. Okay, so number one, you want to be healthy in terms of your diet. And Mediterranean diet has been shown in the neurodegenerative literature to help slow progression of cognitive decline. So that's number one. Number two is exercise. And we talk a lot about exercise, and there are different forms of exercise that can be helpful. Typically, though, we want to think about cardiovascular exercise because, again, we're trying to help this heart-brain connection. And so walking, we recommend 2 miles 3 times a week or 10,000 steps a day. If you can do it, that's amazing. And then along with that, something that people don't think about as much as we would like them to is hydration. So a lot of this has to do with blood flow through the system. We want to optimize our water, electrolyte consumption to be able to make sure the blood is going to where it needs to. And then in addition to that, we want to think about cognitive exercises. And this is something I preach all the time. How can we optimize our cognition? So reading is the best activity. We also think about puzzles, crossword puzzles, Sudoku, things like that. But what I have found is reading out loud is actually even better than reading to ourselves. So passive reading, oftentimes we're skipping words, we're not necessarily articulating, we're not optimizing our hearing associated with it, but reading out loud for 30 minutes a day is something I've asked all my patients to do who are concerned about cognitive issues, because it's training your articulation, it's working on your cognition, and then it's also working on your sensory input from your hearing.
Does it matter what you read?
Not necessarily. We want people to enjoy the reading. So sometimes I have people read to their spouse, sometimes they read by themselves, whatever works for them, but the 30 minutes is the most important part.
I want to go back to exercise for a minute, because from what I've learned, the types of exercise and the duration are very, very important. So you talked about walking. Is it a slow pace? Is it a fast pace? Should you be getting out of breath? What, in terms of walking, is most important, or steps?
So what I usually say is a pace that's rapid enough where you can speak but not casually. So you can speak while you're walking. You don't want to be necessarily out of breath, because then you are going to have trouble with accomplishing the 2 miles if you're walking that quickly. But where you can still have a conversation, but it's not a casual conversation. You're definitely getting your heart rate up along with it.
Now, from the research that I've done, weight training is one of the most important things, at least in my research. So I'd love for you to talk a little about that.
So weight training, in addition to walking, is ideal. So if people are able to do that and include that in their exercise routine, that helps not just with their cognitive aspect and their cardiovascular piece, but also in terms of their bone health as well. So we know that that is useful for a number of different things.
And what does it do in the brain when you're weight training? If I know I'm going to get this wrong, but I believe there's some sort of chemical that's produced.
So there are a variety of different chemicals that are produced when we have our exercise capacity optimized, and some of those are neurochemicals. So some people believe that you have some increase in terms of your serotonin, which is a stimulant in terms of kind of happiness and mood. Some people believe that there are Dopamine increases. We definitely see that in our Parkinson's patients who have a rigorous exercise routine. Their dopamine increases. That's an important neurotransmitter for motor function, but also for cognitive function. And there's a suggestion also that norepinephrine and epinephrine also are optimized, and those are autonomic medication, or they're autonomic neurochemicals that can help with things like blood pressure control, heart rate control, and those, and also help in terms of other automatic functions in the body.
When you see someone who comes in and they have mild cognitive symptoms, what are the things that you still push for above everything else to help prevent the cognitive decline from increasing rapidly?
So some of the things that we talk about are the blood pressure, the cholesterol, optimizing health and wellness. We talk about the cognitive piece in terms of working on the reading and the puzzles. But in addition to that, I also talk a little bit about supplements. And another piece that's important to know is that people who have nutritional deficiencies, in particular vitamin D, vitamin B12, in some cases if iron is very low, these can also cause difficulties with cognition. And so what I like to do is a routine panel of some of these vitamin levels and supplement individuals if they're below the normal levels to help them in terms of having the building blocks that are important for neural health.
When should we really start focusing on our exercise, our water intake, doing cognitive exercises as well? Is that in our midlife, earlier in life, later in life?
I think of it in a way kind of like how we look at skincare, right? So we start at an early age. The earlier we start with these things, the better we're going to have in terms of improvements in later life. So just like we put it on our SPF every day, we should be reading to our children, reading together, reading out loud individually as couples. We want to be doing that. We also want to be starting healthy habits in terms of nutrition as early as possible, and also hydration. Nowadays we have a lot of our youth with their Stanley water bottles or other ones, which I think is fabulous, and makes me so happy to see that, because I think it's helping us with early habits. I think from a cognitive standpoint, we should be thinking about this probably no later than our 30s, honestly, in terms of getting into a routine where we're exercising our minds and our bodies to try and push, again, off these cognitive impairments till as late as possible.
I want to jump, I guess, back to the early life predictor, which is a quality education. Not everybody has access to that. And, you know, many of us are fortunate enough in Northern Westchester to live in school districts that have pretty decent, good, some would say great, quality of public education, but it really depends on the child and the teachers and everything. So how can parents help improve their child's quality of education if they can't afford private school or fancy tutors or the right intellectual summer camps?
I think the most important thing is reading to your children when they're young and getting this whole love of reading to be part of their routine. So we think about reading and language as left brain activities, but the other part I think that needs to not be neglected is all the right brain activities. So we think about music, we think about visual spatial, we think a bit about math activity, some left, some right brain. So it's important for children to be able to have those types of things nurtured as much as possible. While we often have that happening in the school systems, sometimes after school programs can be utilized, the Boys and Girls Club. I think that getting back to the local libraries is so important too, where, you know, we have exposure to a great array of books as well, and at no cost. So utilizing the resources, particularly in cost-limited environments. The other wonderful thing, I think, is to use technology for those things as well. So we're seeing a lot of videos for technology, but there's ample opportunities to be reading using our tablets and our computers and our iPhones as well. So utilizing those resources to try and increase our exposure to language, helps us. In addition, some people believe that learning additional languages can help
Yes.
with cognition. So learning a second language, if that's offered in school, can also help with your cognitive functioning as well.
Something I read recently said that as we age, the two biggest things to help improve cognition are learning a language and learning a musical instrument. Is that correct?
In terms of kind of jump-starting the brain, those two things definitely require a lot of neural networking. And so what we want to do when we're thinking about the brain is we want to develop these neural networks when we're young, and then we want to preserve them throughout our lives and try and jumpstart them if needed, if things are kind of quieting down or not as robust as they were when we were young. So learning another language, learning a musical instrument in our later stages can be helpful for doing that.
We don't have much time left, so I'm going to ask just a couple of quick questions about testing. So I'd like you to actually briefly explain what the amyloid B protein is and why it's important for dementia diagnosis.
So amyloid B, beta amyloid, is a misfolded protein. And it is associated with Alzheimer's disease along with tau. And so these two abnormalities contribute to Alzheimer's symptoms, we think. Now, it's still a little unclear as to whether or not these pathologic changes cause the cognitive issue or they're a marker of the cognitive issue. But we do see that the studies and the research is showing that the more we can reduce the buildup of these toxins, we think, pathologic issues, the better people do and the slower their disease progresses. And so a lot of the newer therapies for Alzheimer's disease are aimed at trying to reduce the accumulation of these pathologic changes.
Which perfectly leads into my next question. There is testing to test the buildup of the amyloid protein. Why, I think it was last year, it was recommended that it not be done when people are younger as a preventive thing to see if that buildup is occurring before it's maybe too late, so to speak. What is your thought on that? Why did they make that recommendation?
So the way that science moves is that there's a disorder, and then we try and figure out what's causing the disorder or what some of the markers are. What then happens is that those tests are used for people who are already symptomatic, because typically preventative treatments are studied in patients with the disease. Currently, there are no specific treatments to prevent Alzheimer's disease. We just have lifestyle modification, risk factor modification. And so the general consensus is having people tested early when you can't give them a treatment isn't necessarily useful.
Right.
That's usually the thinking. However, usually what happens is as the testing becomes available over time, there is a push towards what we call pre-symptomatic diagnosis in terms of, again, pushing off the actual symptom onset. And so what I suspect is, although it is not part of routine testing now, I suspect it will be in 3 to 5 years from now.
And can't things like exercise and change in diet and hydration help prevent the buildup?
Yes. And so we say that anybody who has risk factors for cognitive issues would definitely manage their life as if they may someday develop it. And so starting all of those things early, none of them are detrimental to them and can only help them not just with cognitive issues, but with many other neurologic issues as well. So it behooves people to get on board early on with all of those different lifestyle modifications. And then the other piece is that as these markers become more readily available earlier and in a pre-diagnostic way, and then also as the genetic field and precision medicine expands, all of these things are going to help us to determine not just what our risk factors are and risk factor prevention, but earlier ability to treat and stave off the onset of these symptoms.
Anything I didn't ask about dementia, Alzheimer's, and especially about prevention that you think would be important for us to know?
I think the other piece that we touched on a little bit is socialization. So a lot of times what we find is the patients who have dementia, and Alzheimer's in particular, do so much better when they're involved in different types of group activities. So what I recommend too for my patients is that they get involved in their senior center or their local groups where they can participate in either exercise programs in that way or other types of social interactions, whether it be dancing, singing, bingo, etc. And that socialization helps to improve not just their cognitive speed and processing, but also improves mood as well, which is a significant impact, has a significant impact on cognition.